We are going to by far have the most advanced facility in the state, if not within the Northwest United States. We have an ophthalmology surgery suite, which will be strictly for the ophthalmologist doing his glaucoma, cataract surgeries, eye surgeries. And so these three separate areas, the personal protective equipment prep for the techs to get and gown up, doctors, our iodine prep, the chemotherapy, the radioisotope prep, having what's called a hood, a special hood to make sure that chemical exposure is vented out, and then the iodine treatment area where the patient will stay while receiving that treatment. Bottom line, adding a lot of extra things to make the client and patient experience a lot more enjoyable. Wait times reduced, services and opportunities and options increased and improved, and an area to be able to recruit and retain the professionals that we want to have within the Tier 1 team.